Okay, hi everyone. Well, a special treat today. Um, I am excited to introduce Haley Fisher, also known as HXF4417, a wonderful alum from our MHA program. I was recently able to connect with Haley, and I'm thrilled that she's going to be sharing some of her experiences in data utilization, which is really going to be helpful for the final project in our course. So I'm going to ask Haley just to introduce herself, share what she's been doing since graduating from the MHA program, and then lead right into it. Thank you so much, Haley, for joining me and for being here today.
Yeah, absolutely. Thanks for having me. All
So,
right.
how about introduce yourself?
Okay. Yeah, absolutely. So I did finish my master's at USI in, I believe, 2016. So since then, I moved back closer to my hometown. So I'm based out of St. Louis. I work for BJC Healthcare. So we've got about 14 hospitals and then the med group, some outside service lines like behavioral health, home care, things like that. I work in uh, strategic planning. So it's part of our capital and planning process. I'm a manager for operations. So I tend to focus in community and rural health. And I've
Okay.
been doing that for I think almost 9 or 10 years now.
Get you now. Amazing. Sounds good. Well, I'm going to let Haley take it away and mute myself. This is really a very practical um, sharing of process improvement, but using data from a quality and quantity perspective, but thinking about improvement and strategy. So thanks again for joining. I'm going to mute myself, Haley, and let you take it away.
Awesome. Thank you. Yeah, so like we said, we're going to go over data utilization and how we think about using data in process improvement, and in strategy. So when I think about using data for problem solving and creating strategy, things like that, the first thing that I always want to think about is qualitative information versus quantitative information. So I think everyone generally knows what that is. Quantitative is numbers, is facts. Qualitative is can be feedback and things like that. And where I think it's really important, especially in healthcare, is being able to blend the two. So, in healthcare, especially compared to other industries, sometimes our data sets aren't as robust, as clean. My iPhone can tell me everywhere I've been for the past 10 years, but we don't have that same level of data, or at least accessible data for healthcare all the time, especially if you're thinking about like a small physician practice or something like that. We've got different resources than maybe a large hospital health system. So being able to use both qualitative and quantitative information and really bridge the gap and kind of be creative in how you tell the story, I think is really important. I also think it's the most fun. So that's what I love the most about strategy and using data, is being able to be really creative in thinking of new ways to answer questions and solve problems. So, if you ask me, the first way to become really, really proficient in using data is to become really, really good at scoping. It's something that I talk about with my associates all the time, is being able to really get to the bottom of what we're trying to do and sort of cut out all the fluff. And so there's 5 key steps that I really think about in scoping, but the most important is being able to answer the question. So sort of famous for the line in meetings of, well, what question are we trying to answer? What problem are we trying to solve? So a lot of times, especially working with operational leaders, you'll have a lot of anecdotal information, a lot of qualitative information, and really want to get to that bottom line. And a lot of times terminology will differ between different organizations or things like that. A lot of times too, people who don't use data on an everyday basis, they sort of know what they've seen in the past, right? So if my team or I have helped with market data in the past, that might be what they're asking for now because that's what they know, when maybe it's utilization data or referral data that's actually going to be most helpful. And so even when someone comes to me and says, hey, I want a market analysis, I always come back with, great, happy to help. what question are we trying to solve? What problem are we looking at? And then that really helps drive the analysis forward. So if you learn anything from the 5 steps, that's the most important one. The other things that are thinking about your purpose. So if we're really driving change, that's maybe a different analysis, has some different parameters than if it's, sort of a nice to know, something we're keeping an eye on, some annual reporting, something like that is a lot different than really having action or driving change. And so knowing your purpose, I think is really helpful as well. And as we think about key stakeholders in an audience, sometimes I think these two get sort of blended together, but to me, they're really different. So when we think about key stakeholders, it's who's going to be impacted the most. So first and foremost, always patients, right? When we work in healthcare, whether you're on the front line or you're working in Excel, like I tend to do, patients are most important. So always thinking about patients, but also thinking about potentially the staff of location, something like that. It really helps you get a starting point. So a lot of times when I'm talking about blending qualitative and quantitative information, a lot of time the qualitative information that I hear will point me in the direction of what data source I need to use or where I want to start digging into the data. And so that really helps point you in the right direction. It also helps you gauge how practical or realistic your solution might be. I can come up with some really great fun solutions, but it has to be able to be implemented. And so your key stakeholders are really helpful in that aspect. And then when we think about the audience, that's who's the decision maker. And so I probably ask this question 10 times a day, who's the decision maker? Because that really depends how you present your information. And sometimes that changes through a process, right? Maybe you're working with, an operational leader, middle manager, something like that at first to get some buy-in, to get additional information. Then eventually we're going to go to the lead physician, the practice owner, hospital president. And your presentation should differ depending on who you're talking to and what level of information you want to present. I always say, how far in the weeds do we want to get, right? So knowing who the decision maker is, who your ultimate audience is, I think is also really important. Then as we think about timeline, obviously we want to make sure we get our work done on time, but also I'm thinking about what our goals are as far as implementing a solution. So a quick change that's maybe operational that we can make in 6 months is a lot different than a 2, 3, 5 to 10 year plan. And so knowing how long we have to implement a solution definitely tells us what type of solution we want. It also impacts the types of data that we can use. If we need a solution next week, I probably can't go gather data at our clinic in 2 days. Maybe you can, maybe you can't. And so that impacts what types of data you use as well. And then, of course, always think about the interdependencies. I think that's true in any industry, but especially in healthcare. We've got a lot of back and forth and a lot of ways that we can impact other service lines, other people. So always wanting to think about the interdependencies there. But I will say, if you come up with anything, if you remember anything about scoping, always what question are we answering, what problem we're trying to solve. Most important one. That's what I would focus on. Okay, so I brought a bit of an example today for something that I might work on in one of my community markets. I have a community hospital with on their campus a really successful breast center. So it's attached to an OBGYN practice. While they are successful, their chief complaint is the time from a screening mammogram to a diagnostic mammogram. So if you have an abnormal screening, the chance potentially of having breast cancer, something like that, wanting to be able to get that diagnostic reading right away. So we don't have people in limbo for a month or something like that, always wanting to make that time shorter. That's really our chief complaint. I had an abnormal screening and I couldn't get in for 20 days. For 20 days, I was waiting. It's in purgatory. So that's really what we want to improve. And then also want to grow the breast center. So that's the question that came from my client, so to speak, is how can we improve the patient experience and then grow the footprint? So if we think about our scoping questions then, the real answer of how we can improve is how can we shorten our screening to diagnostic time. So just narrowing that scope a bit and then thinking about your overall growth. Our purpose here is definitely action. We want to make changes. So that's something important to think about when we're looking at our types of analyses. Our stakeholders, patients, staff, leadership, our overall audience, in this case, is going to be the hospital operators because they'll make the decision around the breast center. And then our timeline at this point is actually a long-term solution. So if we're thinking about a 2 to 3 year, potentially 5 year, if there's multiple steps of your solution, you can make just more detailed work about how we're going to make change. And typically that'll require some capital, things like that, but it's a long-term solution. So we can make more drastic change. So after I've scoped, that's when I start to think about what are some of the questions that I'm asking myself. One of my mentors always says, if you stop and say, oh, that's interesting, I wonder, XYZ, that's the first place to start. So these are sort of my I wonder questions. Are the units being used efficiently? Could we be more efficient? Could we offload to other locations to make additional room? Are there other locations that would benefit patients? Is our market underserved? Do we just not have enough clinicians or enough equipment in this market to serve everyone that needs mammograms? So those are some of the questions. And then you'll see below, start to outline, how could I dig into that question? How can I answer that? So if we're thinking about, are we being used efficiently? That's a physical asset utilization. So the mammography units themselves. Maybe it's your scheduling process is a bit off. Maybe it's productivity. There's a lot of different examples of what that could be. And we'll start to dig in once you start with that brainstorm. So then something that I would say is the most important, as not only as you work through the analysis, but also as you're presenting it, is being able to tell a story. So I like to think of it as like a funnel or a stair step if we're going down the stairs, but think about a funnel when you're storytelling. So we're going to start really broad. How can we make this better? How can we shorten wait times? And it should really narrow as you go. And the types of analyses that you work through are going to narrow as well. So it's really two funnels. It's how we work through the problem, and then how we tell the story of the problem and solution to our end users. So in this case, we have the example again of the breast center. How can we shorten those wait times? How can we grow our overall footprint? So I like to start with a current state assessment. We can't know where we're going until we know where we're at. So I think about our breast center today. I know that it's fully utilized, so we can't be more efficient. That's not the easy lever to pull. Right now, our wait time is 20 days for diagnostic, from screening to diagnostic. We want that to be 10. We want to cut that in half. And our wait time to get in for a screening is 60 days. We want that to be 30. So really wanting to cut down those wait times because that's the biggest patient satisfier. That's the biggest thing that will affect their experience. So right now we've got about 5,000 screenings and 2,000 diagnostic cases per year for 7,000 total. We looked at our overall market and know that there is an overall market need for additional services. And I have an example of that we'll go through in a minute. And then also we know that some of our other hospitals in the system are sending their own diagnostic patients to the center because they tend to get them in quicker. So as we're thinking about solutions, we need to think about some of those referrals in addition to our own market. So now that we know the current state, we're going to start moving on to our market research. So this can be a lot of things. This can be national studies, think of white papers, things like that. It can also be talking to your own employees, your own patients. So in this case, we did some research to know that while nationally speaking, while patients like being co-located, mammograms aren't typically a fun thing for women, so being able to go to the same place, seeing the same people is a comfort, something that people really appreciate. However, the absolute highest patient satisfier is being able to get in quickly. So while co-location maybe is important, we know that that wait time is the most important, and that's what that national research has told us. Then, as we start to poll and talk to our own patients, we've identified a subset of patients, generally our younger patients who don't anticipate needing maybe that diagnostic exam. that they're okay with receiving care offsite. They're happy to go to a site maybe closer to their home, closer to their work, and they aren't necessarily married to the breast center itself and coming to this center on the hospital campus, which is great information to know as we think about potentially shifting volume away. And that's where we're at in the analysis at this point. At this point, our team decided, okay, we know that we need to get people in for diagnostics quicker. So we need to create more capacity for diagnostic mammograms in the breast center location. And to do that, we can't expand the physical location of the breast center. We're going to have to move offsite. So then we work through a shift analysis. And again, I'll have an example in a minute. But right now we're using about 2 units for screenings, 2 units for diagnostic. In our future state, after we do this shift analysis, we're going to use 3 units for diagnostics, opening up a ton of capacity there. 1 unit for screenings at the breast center for those patients that do want to have that in-house all in one location experience. My mom is one, for example. She loves having that one place she has to go. She knows how to get there. She knows where to park. She's good to go. But we're also going to have 2 additional sites for some other patients who maybe don't mind going to a different location if they can get in quicker. So now that we know that we're going to expand capacity at the breast center for diagnostics and move some screenings off campus, the question is, where are we going to do that? So now we're going to go through a site selection process where we do what I call an opportunity matrix, we'll talk about in a minute, to use quantitative information to identify the highest opportunity zip codes. And then after we have those highest opportunity zip codes, we're going to use our own qualitative knowledge, what we know about the markets, patient preferences, things like that. And also, truthfully, where we already have locations. So where do we have doctor's offices today that we could add a mammography unit, and that would make sense for writers and really for patients. Is it next to a primary care office? Is it next to an OBGYN office? So wanting to make sure that we think about our site selection. So since we've moved down our stair step or our funnel here, now we've got to our solution. So how can the breast center shorten wait times for diagnostic mammograms and grow overall footprint? Well, our solution is that we're going to offload screening volume to 2 additional mammography sites and expand the diagnostic opportunity at the breast center, which will shorten our wait times. And then the addition of those additional units will allow room for growth, which is our overall solution. So you can see how we start with the problem, break down into really a few different analyses, and then get to our solution. And when we started this analysis, maybe we didn't know exactly how we would get to from point A to point B, or what our solution would be, did a really good job of documenting our thought process, which is really what telling the story is. So I think that's helpful when you're explaining to different audiences. So if we're talking to a hospital president, this might be the level of detail that they want. They trust their associates to do the work. This is the information they need. Go for it. But then we're also going to have to sort of show our work to others, right? And so that is some of the examples we're going to give with the analyses here. And hopefully some of these analyses will help you be able to brainstorm for your own projects, just some sort of ideas of how you can use data to enhance the patient experience. So our first analysis is really around market need. And so I think this is always something that would be important to make sure that we have a market need, right? If we're trying to grow volume in a market that doesn't need additional services, that's going to be really difficult to do. We're going to have to pull volume from competitors. A lot of times that doesn't make financial sense, right? So we want to make sure there's a market need. So the first way to do that is to start by identifying your service area. We can't identify a need without having kind of that denominator, so to speak. So there's a lot of ways to do this. The way I think about service areas, assuming that I have patient origin information by zip code, is to look at patient origin, look at the top 75% volume of those zip codes and make it contiguous, which really just means that they touch each other. So it forms one cohesive service area. That's my typical methodology, but there's a lot of ways to do that, right? We can do it with anecdotal information. If we know that 90% of our patients come from Evansville, we use Evansville, right? If we know that we have people traveling in from some more rural counties, we add those counties in our service area. So there's a lot of ways to figure out what your service area is. After we do that, then we start to look at our volume estimates. Again, a lot of ways to do this. If you're working with maybe a large health system that has some purchase data, some vendors, maybe they have volume estimates for you. Maybe you have to use some publicly available information to estimate those visits. A lot of times, you can always get population estimates, right? That's publicly available information. You can almost always find ratios. So, there's X number of mammograms per 100,000 population, and you can use that ratio to come up with your denominator, your total number of visits in the market. So in this case, we're looking at screening and diagnostic volumes. In this market, shown there's about 73,000 screening volume estimates. In diagnostic mammograms, we have about 17,000 cases. So when we pull in our own volumes, then we know that we have about 8% of the market. So not a lot, right? We also know that in our specific market, there's only two other competitors that are similarly sized. So even though I don't have their volumes, I can make some estimates. They're similarly sized to us. Think about adding another maybe 16% share. We've still got a ton of wiggle room, a ton of market opportunity. Maybe it's patients who aren't getting care today because they can't get into care. Or in my case, working in community and rural markets, it's maybe people leaving the market who could get care closer to home if there were additional opportunity. So based on this analysis, we know we have opportunity for additional care. So then we start to look at how we can shift volume offsite. So this is what we talked a little bit about when we were talking about storytelling, is a shift analysis. So right now, at the breast center, we can see over here in the current state, we've got 4 units. 2 units do screenings, 2 units do diagnostic mammograms. Those take a little bit longer. In the future state, we've looked at how much we want to increase our volume. So our work group had the goal of creating an additional 2,000 cases, which would increase our market share by about 2 points. So we would go from 8% market share to 10% market share. And then we use that conversion rate. So how many of our screening cases are translated into diagnostic cases to estimate what our breakout would be. So all in all, we think our future volumes will be about 6,650 screenings and about 2,350 diagnostic exams. So in order to do that, then we start our shift analysis. And we work through how many screenings, diagnostic cases you can do per unit per year, and then start to spread that way. So we ended with our breast center still has 4 units, but in future state, we'll have 3 units dedicated to diagnostics, 1 unit dedicated to screenings. They might mix and match, but for the sake of numbers, that's how that'll work out. And then we'll have 2 additional locations that we'll do screenings at as well. And again, this is where some of that market research comes in of where should those locations be. So as we think about where the location should be, I like to use what I call an opportunity matrix. So that's this bottom chart here. We look at our service area and we pull a lot of quantitative information, things that we think are important for choosing a site. And so that's variable. It can be a lot of different options, but in this case, I chose population. So at the time was 2023 population. An overall growth percentage. In community and rural markets, that varies a ton. So I typically try to do both population and growth. And then looking at our commercial and Medicare payers just helps things pencil as we're thinking about the capital required to add 2 additional sites. And then looking at our overall market share. And in this case, I actually think of that as an inverse. So if we have low market share, that's higher opportunity to break into a new market. So once we pull all of this data by zip code, I start to force rank them against each other. When I say force rank, I really just mean you put them in order, you give everyone a score, highest to lowest, and then you add up your scores all the way across. And it gives us kind of an unbiased view of what some top priority locations may be. So in this case, our highest scoring location is the zip code 6,000. That's not a real zip code in my market, but you get the idea. That's our highest scoring zip code. While they only have a medium population, they've got the highest population growth. They also have a high percentage of commercial and Medicare payers, but they also have a low presence or market share in the market, which gives us high opportunity to break into a market. And you can see that on the map here. So as we use this quantitative information to look at our overall locations, I think it's also then where we start to look at qualitative information, right? And you blend the two. Because while 6,000 is maybe the highest scoring zip code, we might know, that market though, there's tons of our competitor in that market. We're probably not going to shift those patient patterns, those patient preferences. Maybe 2A is going to be a better fit for us. Those are some ways you can use that qualitative information. Also thinking about where we have sites today. So where we already have physical locations that we could add sites that are closer to patients. So closer to where they live, closer to where they work. So those are just a couple examples of analyses that we use to tell this story.
Okay, that was excellent. Thank you so much, Haley. I wanted to ask you just really one of the things you focused on at the beginning, which was the importance of determining what question you're trying to solve. That really stuck with me. The MHA students who are listening to this will really be focused on one question. Can you tell me again, can you just reiterate why is it important to narrow down this question they're trying to solve? And I noticed with this breast center example, there was really one question, shortening wait times. Can you just go over the importance of that, or maybe challenges that might come about or you've experienced when you have the team hasn't narrowed down the question yet?
Yeah, absolutely. Well, I think especially in healthcare, there's so much to do, right? And there's specifically when we're thinking about clinicians and operators, they're so close to patient experience, which is great that you maybe have a lot of different opinions as well. So you've got people that are experiencing different things, whether that's, someone who's maybe working check-in versus someone who's in a room with patients. They've got different experiences and different ideas of maybe how we could make improvements. Problem is. And so typically we get tons of ideas. And when we have something that's as broad as how do we improve the breast center, there's about 100 ways we could do that, right? And so being able to get down to, okay, when we say improve, what does that really mean? Well, our biggest complaint is that the time from screening to diagnostic is too long. Well, that's your real question, right? It's not how do we improve, it's how do we shorten that wait time. And being able to really get down to what I call like the bottom line question, the bottom line problem, it will make you very popular at your work site. If you can cut through all of the extra and get to the real problem, you're going to be way more efficient and you're going to have way more realistic results, I think.
That's hits homes. It hit home very well. Last question I have is I was really intrigued when you mentioned the I wonder questions, and you
Yeah,
had a mentor who said that. Can you tell me a little bit more about the importance of that? What is the importance
yeah.
in this exercise to have these I wonder questions?
Yeah, absolutely. So one of my favorite managers presented this to me when I was a very young associate on the team and was spending a lot of my time in Excel with big data sets. And a lot of times the request that came to me from manager, someone in my position now, was give me a market analysis for XYZ. And I would do it. I would go over it with her to make sure that I'm doing things correctly, right? And I would say things like, don't you think it's interesting that that hospital had an increase of 10% from 24 to 25? Like, that's really interesting, right? She's like, that's it. That's how you go next. If you look at something, you say, that's interesting. I didn't expect that. I wonder why that happened. We saw an increase of 10% in outpatient cancer volumes for our competitor. Where did that volume come from? Was it a specific procedure type? Was it a specific patient type? Is it from a specific zip code? And then you keep narrowing that way. We talk about drilling down into information, and to me that always starts with I wonder why. I wonder why that is. And a lot of times the data will tell you where to go, right? So in that example of cancer growth, um, maybe it was a specific zip code. And so then we bring in qualitative information, right? Like, well, that's a zip code that that hospital doesn't typically pull patients from. I wonder what they did different this year. You start to research, right? Well, oh, they added a new provider office. Clearly, that provider office has been really successful. And maybe you don't always have a solution, but a lot of time just saying, I wonder, gets you pretty far into an analysis and getting to really the root of the change or the problem.
So excellent. Haley, thank you so much for sharing your insights and your experience, and especially with this example. It was really wonderful to listen to, insightful, but also I'm proud you're an USI MHA alum. So
Well,
very cool.
thank you. Thank
Sounds
you.
good.
Learned a lot.
Excellent. Great.